I was a general orthopedic surgeon for my entire career, as I am now, but have become more and more specialized in hip and knee replacements. So I've been here as the director of the orthopedic program at Hilton Head, and was asked to set up a hip and knee replacement program, which is now up and running. And then the joint program took off. So if you're doing a good job, word will spread in a very positive way. If you've been forced to change your life, your activities of daily living, or your mode of exercise in any way because of pain or loss of motion, so the bottom line is you come to see me about a hip or a knee. It takes no time at all. It takes a 5-minute history, 5-minute exam, some x-rays, and we can paint a very clear picture for you as to what you can do to keep going. My goal is to try to take care of you without an operation, to treat you non-surgically, but to offer you that option if that's really what you need. And I will be very honest with you. It's immediately gratifying to have somebody who can barely do what they want to do day to day and get them to a better place so they can live their life functionally. So investing a relatively small amount of time, small amount of money for a huge outcome to keep going. The joy that I have is seeing people after they've gotten something done. I want to see their face and I want to enjoy their improvement. If you've come to see me, I'm going to take care of you. I'm going to do your surgery. I'm going to see you before. I'm going to see you after. And that's what sets us apart. I wouldn't be here if I wasn't proud of it.